Good afternoon, everyone. We will be starting in just a moment. We've got 180 people already logged on, and the number continues to climb. I want to thank you for just muting as you're coming into the room. We do hope this will be an interactive session, but thank you just as everyone level sets. We appreciate you coming in and muting yourself. I'm really excited to be in this space today, and I want to thank you all for taking away time from your regular busyness, your projects, your initiatives, your passion, the labor of love that you've made a commitment to, and for joining us today, this Tuesday, July. Thank you so much. So we've got over 215 people now who've joined us today. And I'm just going to give a quick check to my good friend and colleague, Megan, to get the okay to get started.
Let's do it.
Okay, fantastic. Very good. Well, hi, everyone. My name is Denise Octavia Smith, and I bring you greetings from Hartford, Connecticut. I know we're virtual and excited to find out where you all are from all over the country. In fact, if you want, you can use the chat to introduce yourself. There are always wonderful connections to be made in the chat, so feel free to do that. But I bring you greetings from Hartford, Connecticut. I'm a community health worker, and I'm the inaugural executive director of the National Association of Community Health Workers. And I bring myself, my work into this collective space, into the Vaccine Equity Cooperative. And I'm just thrilled to be with this panel of colleagues, partners, really soulmates in this work as we bring forward this fireside chat today. So let me take a moment. Thank you. I see the chat blowing up. Please do introduce yourself. I'm going to take a moment and just walk through the folks who you'll be hearing from today. And I hope that that will include you either through the chat or one of the other avenues and channels we have for engagement. So we're welcoming to the fireside chat Jarrell Brooks from the Love and Justice Consulting. Jacqueline Dalton is joining us from Health Leads, and she is actually going to be introducing herself to this community, leading the Vaccine Equity Cooperative. My good friend and colleague, Rishi Machanda, doctor and MPH, a great partner who's bringing the Health Begins community forward. I just want to say a welcome to Scott Razan. I want to say a fantastic welcome. He's coming from CUNY from the university and is also leading some incredible work in our Vaccine Equity Cooperative, which you'll hear more about. Can't forget my wonderful sister and partner these last several years, Alexandra Quinn, Executive Director at Health Leads. And I've already introduced myself. We've got some other community members in the Vaccine Equity Cooperative leadership who are in this community as well, but you'll hear from some of those folks as we continue on today. Next slide, please. Okay, so as I mentioned, we don't want to be the only ones communicating today. It's important that we recreate this space that we've all become familiar with, which is often passive, right? We're often logging onto webinars and sort of listening in. So let's take a moment and just take a look at the screen. There are going to be a couple of different ways that we'll be able to connect with you. First, if you haven't already done so, orient yourself to the webinar space and find that globe so that we make sure that you have your interpretation icon selected to either English or Spanish. If you would like the option for a live transcript to have closed captioning at the bottom of your screen, you can click on the CC and get that live transcript and closed captioning going. Other features that you can use include the Zoom chat feature, and most of us have become familiar with that. You're already using it to introduce yourself You're welcome, Mishi. Happy to provide those accommodations. So make sure you found the chat feature and you've introduced yourself as you come into this space. We are going to have a couple of polls that we'll be launching, and this is a way for us to get to know who's in this growing community. We've got thousands of people who've connected to the Vaccine Equity Cooperative over this past, almost two and a half years that we've been together. And as I mentioned at the start, thank you so much for remaining muted. It's not that we don't want to hear from you, but we just want to make sure that as folks come in, they have a chance to orient to the speaker at that time. Next slide, please. Wonderful. I love it. Health districts and CBOs, cities, outreach organizations, action agencies, nurses, looking at so many alliances, lots of different folks who are joining us today. Thank you so much for giving your time. Okay, so as I mentioned, this is not your usual webinar, and I hope that that is what you're looking forward to today. We've called it a fireside chat, and we're going to get as close as we can in the brief time that we are together. But we're really here to celebrate. You can feel my energy. I hope I am with people that I adore working with, that I deeply respect, and who are pushing me further and forward in the work that we do collectively to advance vaccine equity and far beyond. So we're here to celebrate and love who we are, what we have done, and how we've worked together. And if you're newer to this community, you're going to hear a little bit of the history, but you're going to hear some of the very exciting present and how your voice, how your presence, how your work is so integral to bringing a reality of millions of people leaning in and impacting health equity at the hyperlocal level and all over the globe will be relevant and actionable to you. We're going to reflect on some of the opportunities, needs, and challenges. Let's be real, we're all pushing through something. We're all confronting something, or else we wouldn't be doing this work. Change is not always inevitable. It is something that you have to choose. And living and leading with your values is something that we are choosing to do. And you'll hear more about that, but it's at the heart of equity in the Vaccine Equity Cooperative. Developing a shared vision is also something that you're going to hear about from the leaders here. And we want to join with your vision and understand your vision because we all have a piece of this answer. Again, loving hearing and seeing folks from all over the country. Next slide, please. So, hey, you might already be tired of hearing my voice. I'm going to be with you for just a moment longer because as we were preparing to create a wonderful space for you to come in and contribute, many of you, I'm sure, are familiar, but in the community health worker, the social justice, the organizing and advocacy space, often we present or start with a dynamica. What is that really? It's an opportunity for us to feel one another's presence, to be present in the space, to come from where we were and be present where we are. And so I'm going to take a moment and just offer a dynamica. Sometimes I would ask that, we stop sharing the slides so we can see one another. But you may or may not feel comfortable being on camera, and that's all right. If you haven't taken a moment for yourself, this could be that moment, okay? So I'm going to use as a source for the dynamica that I'm pretty much going to freestyle. A wonderful new journal that has come out. It's called the Self-Reflection Journal for Community Health Workers. It's a guide for empowering your learning journey, and it's brought to us by El Sol, the CHW and Promotora Training and Educational Center. And at the beginning of the journal, there's a very short statement that I'm going to read, and then we're going to act together. It says, the one thing that you have that nobody else has is you, your voice, your mind, your story, and your vision. So let's use those 4 phrases and let's try to get this into our body. I will link the book in the chat. Thank you for asking that question. Your voice. If you could take a moment and just take your hands, and I want you to bring your hands to the back of your neck. You can see me doing it here. I just want you to run them from the way your neck connects to your shoulders until it reaches the back of your head. Your voice is in here, right? It emanates from the breath in your lungs, but it is supported by these muscles, this spinal column, and all of the nerves that move through your body in this area. Your voice is so important, but can we be honest? It gets tired sometimes. Sometimes it's difficult to use your voice. Sometimes it becomes exhausting or it becomes tense. So we want to take this moment and just free your voice. Just notice that tension that may exist. And if it does exist, there's no shame in that, but just notice that. Your mind, oh my goodness, especially in this virtual space, when we forget that people even have bodies, it's difficult to come out of your head and to get into your body. Can you just feel from the top of your head down to your temples? Apply some little pressure and then back behind your ears. Your mind is here, but it's fed by your emotions. It's fed by the energy of others that are around you. It's fed by all of the senses that are feeding your mind, your eyes, your ears, your touch, your smell, your taste. Your story. Without your story, we can't create a reality that is equitable, that is diverse, that it is inclusive. Your story is all that you are carrying into this space across time and generations, through your genetics, through your lived experience, moment to moment. And that story, if you choose to use it as a gift, can be extended into all of the spaces that you touch, that you enter. Can you take one hand and bring it from your shoulders, applying some pressure through your arms and out to your fingers? Feel and notice that there is tension even there in your shoulders, through your arms. Can you notice that? Can you respect it? Can you respect the work that it takes for you to get your voice, your mind, your story out of your body and into the spaces that you impact? And you can just shake some of that off. You can just shake it off. It's okay if all of your story hasn't been told. And guess what? It's okay even if others have not received all of your story. And finally, your vision. Your vision. The Vaccine Equity Cooperative has been developed and has grown as a result of your vision, your expertise, what you've seen and how you've reacted and responded in your community, your population, your locality, your state, and your world. Reach up if you can, reach up and just gently pull your arms toward the ceiling. You can grab your wrist and just gently pull. Our vision is pulling us further. If it's not a big vision that stretches you, is it really worth doing? But I bet your vision is challenging you. You can take your arms and stretch them to the east and to the west, to the north and to the south, behind you, above you, and then slowly, slowly, slowly relax all of those muscles and bring them back to center. I want to thank you so much for participating in this. It's a way to connect your ideas and concepts to your mind and hopefully to one another.
All right. I think, do we lose Denise? I hope not. Hi, everyone. I'm Alexandra Quinn. I couldn't be happier to be with you today. First off, just thank you, Denise, for leading us through that. It's such an amazing way to start the call. I'm deeply, deeply appreciative of this community. So what are we going to do today? One, if you're just joining and you haven't dropped in who you are in the chat, we want to know who's here. We want to hear where you're from, anything else you want to drop in. And we're really excited, as Denise said at the top of the hour, to have this be a shared space. I'm going to talk for a minute just about how do we get here, and then introduce to you some of my colleagues on the phone. And so first off, many of you have been on this journey with the Vaccine Equity Cooperative since, I think it's been 3 years now, although I can't quite remember. It's all a little bit of a blur. And this came about pre-COVID, and I think other colleagues on the phone, on the video, were thinking about this too. Rishi, I'm thinking about you, where a bunch of us got together and said, you know, in our sector, we have tall orders. Like, how do we eradicate racial health equity? How do we improve Black maternal health? How do we improve mental health? How do we be more connected with our global brothers and sisters in health? And often our sector, particularly the nonprofit sector and philanthropy, we're pitted against each other, right? Whether it be for raising money, whether that be locally, statewide, nationally, when in fact, we need a collective movement to actually be able to eradicate any of those, right? To be able to weave beautiful health in the United States. And so about 15 of us got together pre-COVID and said, how do we actually work together? How do we go against kind of the waves of what the sector is asking us to, and say, if we want to hit any one of those issues, we need to do this collaboratively. And we were thinking about, okay, what's a health equity issue we could work on together? And COVID started to make its way to the United States, and Dr. Darrell Brooks, who's on the phone today, and Tanae Hamilton Franklin, who's a team member of ours at Health Lead, said, if we want to work on an issue together, we need to work on vaccines. At the same time, and Rishi will talk about this, he was thinking about community-based workforce and how do we get a collaborative together to work and connect community-based workforce, because we were going to be asked to do so much more during COVID. So we said, okay, let's take that task on. What's it mean to actually work on vaccines? And 40 of us, and some of you may have been a part of it, said, let's write just some vaccine principles out. Like, what do we believe equity-driven principles are? We opened this document, literally 40 different people writing, and came up with this list of principles. That list we know is used by 3 states to plan. It was used locally by maybe some of you to advocate, and that's where this was born. We were so surprised at the interest and even the list. We said, okay, let's start thinking about how do we convene community health workers? How do we convene community-based workforce? How do we convene others and say, what do you need? What would be helpful during the next few years as we think about a COVID vaccine? And literally everything you saw as part of the Vaccine Equity Cooperative was born from that. So fast forward a few years, I don't know about you all, I'm exhausted. I'm thankful. I think like many people on the phone, I've faced my own personal health issues. I actually battled cancer twice last year. And I know I'm not alone, and I'm fine, I'm cancer-free now. I know I'm not alone in both having to handle deeply hard personal issues and health issues and navigate the work and trying to change this country. There is not much of a taller order, and I get to do it all the privilege that I have, whether it be the privilege of my race, the privilege of understanding the healthcare system. And so about a year ago, I think we were thinking about and talking to our community health worker and advisory group, and actually talking about this, like, what are all the things that we're battling and seeing personally, professionally? And I think it was a couple of our community health workers who said, you know, we can't talk about vaccines right now because all we can do is talk about mental health. And mental health stemming from what I talked about, like personal health issues, the system, racism. And so we said, okay, well, maybe we always wanted this to be beyond vaccines. what if we expanded it and just started talking about mental health right now and did a little toe dipping? And Darrell will talk a little bit about the mental health working group. And then I think because it was always our intent, we said and heard more feedback, let's actually start thinking about a health equity collaborative. And so today, that's what we want to talk to you about. We want to talk to you about what are we thinking for the Health Equity Collaborative. We've taken in a bunch of requests. How are we planning to fundraise for it? How do we want every single one of you and more to be along with us on the journey? And we just wanted you to get to know us a little more, right? Like I never do VEC webinars. I get enough play outside of VEC and there's so many cool people to talk to. And I was like, I want to go and be with my colleagues because I will tell you through everything that I've been through in the past year, I could not be more thankful. The thing that has kept me going is this community, is the love of literally Darrell, Denise, Scott, Rishi, Jacqueline. Like I don't know that I would have been able to feel as whole as I do without this community and without the promise of everyone on this phone and on this Zoom to create something different. I'm here to create something different with you. I'm here to acknowledge trauma in myself and others. I'm here to do this in a way that actually keeps us whole and changes this country. So I am so excited, and I'm excited, we're just going to have a fireside chat. We're going to do a poll soon. Megan's probably already trying to get us to do a poll. The first thing I want to do before we do that is I want to introduce one of my favorite colleagues, Jacqueline Dalton. So Jacqueline has been with us from the beginning of VEC. She like everybody on VEC, she both is a rock star at work and just like with her public health and community background and she's a rock star in her own community. And what I've loved is Jacqueline holds no prisoners and just can see the future. So we'll be talking, Denise and I will get off on these things. We're like, oh, we should do this. And then Jacqueline's already actually sent us the proposal. Here's how you do it. And let me improve it for you too. And so Jacqueline, I appreciate your feedback. I appreciate your love. I appreciate how you've co-created with us. And I couldn't be more thankful that you've agreed to direct all of us and direct the operations of this and want to just give you a chance to introduce yourself and say hi to the community.
Well, hello, everyone. And thank you, Alex. Thank you. Thank you. It was such a gracious introduction. I cannot see the future, though, so I don't want to disappoint people. Right? But hello again. I am Jacqueline Dalton and bringing you all greetings from Nashville, Tennessee. I am so excited and really, really proud actually to be joining the Vaccine Equity Cooperative and our future Health Equity Community Collaborative to work alongside even closer Alex and Denise and work with our great partners like Health Begins and Love and Justice Consulting, as well as all of you on the call. For me, these past couple of years with the Vaccine Equity Cooperative has really been inspirational. And it's been a glimpse of what's possible when really dedicated collaborators, I have the background in public health and community engagement, right? So I essentially just work with many community members and organizational partners to make some shared goal happen. And we work together to bring those goals to life, essentially. So with the Vaccine Equity Cooperative, I saw over these last 2 years that all of our partners had a common goal of keeping our communities, families, loved ones, ourselves even, right, healthy and safe. And mentally safe, right? Mentally calm, psychologically safe. And this was not something new, right? But still there was something different. There was a kind of willingness to work together despite the costs, right? Despite how long it took, if we were up all hours of the night, we worked with a sense of urgency that really forced us to think differently. We partner differently. Our approach to our work and our goals were different, but our goals remain the same, right? We focus on the people who really needed the services the most, needed the education the most. We really focused on also the vital players who were providing those services, right? And not just the service itself. And so, coming into this work and being able to see that really inspired me because I come to the Vaccine Equity Cooperative work and the future Health Equity Community Collaborative work, having had the experience of growing up in small town Tennessee with a church family that was really, really my family because my family went to church most of the days of the week. And I literally grew up in church, right? So those church members were my family. But as a young girl, as a teen, and I know some of you are probably thinking, you still look like a young girl, still look like a teen, but I promise you, right? There was a time when the face matched the age. And my grandmother would say, well, darling, you still look like a little girl. So I'm accepting. Okay, Granny, thank you. But there was a time when, imagine that I was a little girl, I was a teenager growing up in church all the time. And my church family was essentially just plagued with suffering from different diseases, illnesses like heart disease. We called them just issues, right? Because everyone seemingly had them, the diabetes or kidney disease, different types of cancer. It was so common that we just kind of accepted it as our fate. And I just remember thinking back on many times hearing, this runs in my family. This is just something that's a part of who we are. But I know now, and I know many of you on this call know that that's not the truth. And there is power in our collaboration to support our communities, our faith communities. When we have knowledge, when we have resources and access to those things, we are able to take a different approach to achieve health, and not just, not just depending on our faith that will keep us healthy, right? There are some things that we can do, those acts that we can do that will keep us healthy. And we know that communities of color do not have to be disproportionately trending with those illnesses. Communities of color, aging communities, communities that are challenged, able-bodiedly, non-native English-speaking communities, and even our tribal and our indigenous communities, right? We don't have to be plagued with those illnesses, and there is power when we collaborate. So that is really what I'm excited to see as we get ready to start this journey with the Health Equity Community Collaborative. I just really want to say thank you all for your participation and your time, right? Countless hours, your support, your effort, and your commitment to this work. And just making sure that, all the communities that we serve can achieve health and have access, right? Have those resources that they need to address some of the issues that we are currently seeing families struggle with. So again, thank you for your support that you've shown. I just think about the work that we've done that Alex was just talking about when we were developing a COVID-19 resource repository, right? And you all shared so many resources that were great, culturally relevant, right? Very useful, very timely resources. Your support in helping us get out millions of COVID-19 testing kits distributed to the doorsteps of families across the country, for helping us even name this new collaborative, right? The Health Equity Community Collaborative, and even our ongoing mental health survey right now, which we already have 168 responses to, and 20% of those of which are from our international partners. So, again, there is so much power in this collaborative. I'm extremely grateful for your support that you've given, that you are giving, and that you will continue to give in this next phase of work. Of course, there's so much happening in the director role behind the scenes and with our partners that we're working with closely, but I know that none of this is possible without you all. I think the opportunity that I'm most looking forward to is this ongoing opportunity of collaboration, continuing to partner, build connections, grow relationships. I'm looking forward to those small wins that really lead to us working together in big, different ways, right? And even those times when we face challenges that, will band us together even closer as a collaborative. So I'll just say again, I know that there is so much power in this collaborative, and thank you all.
Thank you, Jacqueline. And she's not really going to be that behind the scenes, even though she said she'll be behind the scenes. Jacqueline's a phenomenal facilitator, and I'm like super judgy about facilitation, as we all know. So it's just, I'm so glad you said yes and you're on board. So we're going to get, oh, cool. We're getting a lot of answers in. I mean, one of the things with this question is it's so easy to focus on what's been hard, and we know some of the incredible work you've done because you've shared it with us. And we just want to take a moment and also recognize that so many things changed in maybe small ways because of work that you're proud of, right? There's no way pre-COVID our groups would even be working together in the ways that it is, right? Like this would not have been possible. And so it is this kind of bitter proudness that I hold of like, oh, I don't want to be proud of things during such a hard period. And it's important to know what's gone well, and important to be able to know, even just to replicate it, right? So we love the bright spots. All right. So we're gonna let you keep doing the poll. We have good 85 out of 280 answers. Awesome. Love this. And I wanted to introduce another colleague. I'm so excited to introduce and bring in Colin Rishi Manchanda, who has been working with us for longer than all of this, but had a similar vision a few years ago, seeing COVID come on and say, how can we work differently? How can we collaborate differently? How can we support community-based workforce differently? And I too, just like, I love you, Rishi, and I'm so thankful for like your partnership and your friendship and what you bring to the work. And when we were prepping for this, we all were kind of in our caricatures yesterday, and Rishi was like, okay, here's what the objectives were. And I was like, and I want to moderate. And Denise is like, we all are our best selves right now. And Rishi, you both can hold the ambiguous and help us stay on track and just like do it with love. And that is such a beautiful way to be told what to do, with love at all times, and get the reflection and kind of your experience and wisdom. So thank you. Thanks for being here. And Rishi's going to be a new HECC core partner, which we're really excited about too. We're bringing him over.
Thanks, Alex. And thanks, Denise, and thanks, Jacqueline. Thanks, everybody here. A lot of love in the room, a lot of love being received, and a lot of love that I'm sharing back to you guys. So I'm Rishi Manchanda. I'm CEO at Health Begins. Health Begins is a national strategy and implementation firm, mission-driven group that really, just to boil it down, helps Medicaid serving health plans, health systems, and the social sector, community-based organizations included, that want to work with Medicaid to be able to advance their social mission. We help those three groups, plans, systems, and CBOs, to be able to meet growing requirements, to be able to advance health equity, address social needs, but to do so in a way that achieves long-term impact for people and communities who are harmed by societal practices. Why do I share that? Well, because our work, much like everybody here, is deeply informed by an awareness that health and social inequities are really experienced as harm, and that it is systemic issues, structural kind of issues that actually put groups of people in harm's way. And therefore, we require kind of structural solutions to kind of do this. And so when we, based on that kind of observation, again, not unique, I think everybody here shares that, iterates and articulates it in different ways. Rewind the clock 3 years ago, when we were using that kind of set of observations to think about what was happening in the world and the network that we're part of, we recognized that state command centers and the federal government were mounting a response to COVID. And as part of that, governmental public health agencies necessarily were at the lead, along with a lot of focus on healthcare delivery, as you remember, right? The healthcare heroes, those in the front lines. And one of the perennial kind of observations that many of us in public health had is, well, while those are absolutely necessary, where is the kind of third pillar? Where is the civil society kind of response? Where is the community-based response, including the community-based workforce? So in April of 2020, we started having conversations. I started calling friends and family, partners, allies, and asked them, I love you, who do you love? Who are the people that inspire you? And among the various people that came up, of course, were Alex Quinn and Denise and Alex Fajardo and many others who are on the line today. We hosted a call in May 2020. About 400 people from across the country showed up. And what we essentially asked was a set of questions around principles. Is it possible to, as we face at that point, the top 3 health equity priorities, which was to advance contact tracing and address the risks, right, of contracting COVID, the equity priority of making sure that psychosocial supports were in place, and lastly, that we had strategies to mitigate the impact of unemployment. As you recall, of course, that was a huge concern as well. With these top equity priorities, is there a way for us to elevate and center the community-based workforce? Community health workers, doulas, other community-based professionals who bring deep lived experience and skills to bear in a way that can complement and elevate the work of our peers in governmental public health and in healthcare. What became clear was a resounding yes, that we said there are some principles, and we put together 6 principles and 20 organizations at the beginning of 2020 really just endorsed these principles and said, well, let's come together to create an alliance to help animate these principles and ensure that as state governments, as local county agencies, as various stakeholders are coming together to respond to COVID, that at least we're ensuring that these core principles are embedded in the work in order to, again, center this work in community-based responses and not just traditional governmental responses. Principles like recruiting with a racial equity framework, investing in trusted workers, including CHWs, strengthening connections with psychosocial services, launching community-based jobs programs, embedding job training and pipelines into local careers for the community, and lastly, strengthening community infrastructure. Those principles animated many of us, including myself, still do, and gave rise to the Community-Based Workforce Alliance. I think where we're at right now is a recognition both at Health Begins and members of this alliance, including Denise, Alex, and many of us on the steering committee of this incredible organization, having accomplished a tremendous amount of being able to translate those principles into action. And there's a variety of ways in which we're happy to share the results of that in ways that were complementary to, and I think very much synergistic with, the incredible accomplishments of the Vaccine Equity Cooperative, everybody here. When we reflect on those lessons in this moment, what animates me about this conversation and this space and the possibility of the Vaccine Equity Cooperative moving into this next chapter of its journey is the recognition that we're at this inflection point in the journey for health equity. We have an opportunity really to define the next 3 to 5 to 10 years for ourselves and for the work that we do. So that, for example, we're not just optimizing programs, but actually doing so in a way that to reallocate power and resources to communities. That we're not just responding to structural violence, but that we're actually counteracting harmful structures and policies that drive health and social inequities in the first place, and doing so together. And lastly, and perhaps most importantly for me, based on what I've learned and benefited from in terms of spaces like this, along with Alex and Denise and others, is that we can not only just apply ourselves to this work and bring our imagination to what it means to actually do work differently, but that in the process, we can reimagine who we are, reimagine our relationships, our institutions, our structures, and our ways of cooperating together. Because that reimagination is where we find the fuel that's necessary to be able to continue the necessary work to meet the challenges of the day. That's why I'm excited about the HECC and this new chapter, and proud to see that the Community-Based Workforce Alliance is moving towards becoming a part of the structure of the HECC as a potential member as a working group, really within this beautiful structure that's being put together here. So I'll just say I'm grateful, I'm excited. I want to celebrate the work that's been done to date, acknowledge that it's worthy of celebration because of how tough it was, because of how much it drew from all of us, but because of how deep and how rich our journey's been. The future is bright, and it's only bright because we're going to be together and doing this work.
Thank you, Rishi. Thank you, Rishi. Deeply appreciative. Next up in just meeting core partners is Dr. Darrell Brooks, who is, in full disclosure, Uncle Darrell to my kids, and one of my favorite humans in the world, like the rest of the group. And Darrell, thanks for joining us. Darrell was, one of the ones who said, this is the first issue we should work on. So we have you to thank for helping birth this. And have been along the journey for this, his own journey, my personal journey, and I love you. But Darrell, I think you bring so many interesting and dynamic perspectives to the work. And so I'd love to hear why do you want to do this? Like, what are you doing? And Darrell's going to be leading or is leading our mental health working group, our action lab, along with the other ones. And we'll talk about all the different working groups, and we want ideas for more. But Darrell, tell us your why. Why are you here?
Absolutely. Thank you, Alex. I love you, and I love Health Leads. And the beautiful gift about Health Leads is that I actually knew it because I was working in a pediatric clinic in Baltimore City at Johns Hopkins, and the services that you all were providing, making sure that our young people had access to clothes, resources, and getting medical care. I was referring to them to you, your agency, before I actually met you. And so thank you for doing the work. Hi, Hi, everybody. My name is Dr. Darrell Brooks. I hail from Baltimore, Maryland, and I'm the founder of Love and Justice Consulting, where we specialize in co-creating healing and liberatory organizational change initiatives, and particularly focus on healing trauma, race, gender, and sexuality-based trauma. And I also talk about myself as a practitioner. And so I do a lot of social justice and racial healing work. And so a part of the question becomes around my why is that what I've gotten clear about is that when we're operating in systems of oppression, those are actual stressors that have immediate and deleterious impacts on our bodies. And because it has impacts on our bodies, it also has impacts on our mind. And so a part of my work is figuring out what is the responsibility of organizations. When I think about moral safety, what does a morally safe organization do? And from my perspective, it is one that is constantly grappling with the use of policy, practices, procedures to ensure, particularly around utilization of power, how do we promote healing and well-being for everybody? And not just those folks who are accessing service provision, but the folks who are actually doing the service delivery. I've spent the last several years being able to work with caregivers, folks who have not stopped working since the start of the pandemic, and their mental health needs are paramount and important to me. And I've also been a caregiver where I'm sort of actively trying to do this work while also managing, as Alex mentioned earlier, my own personal challenges in life. And so I believe we all have a responsibility to be well, and we all deserve it. And I think organizations play a huge part in our mental and emotional and spiritual, psychological well-being. And so I'm excited to be a part of the mental health working group specifically because we got together and we said, I'm also a school board commissioner, that I've seen in our young people, they've been asking for deeper mental health support services, and yet systems have been unable or unwilling to give them those things. And so in the absence of those particular resources, I think it was important for us to come together and reconceptualize what mental health supports look like from a broader perspective. So it's not just at the clinical level, but what is the role of community members, community partners, community healthcare workers coming together as churches and congregations and synagogue, places of faith and worship, coming together to create safe environments so that we can actually heal together and to do that well. And I believe that ultimately when we come together in community, owning our power and our voice. So Denise, thank you so much for that beautiful dining come out this morning, earlier this session, that when we do that, we all get to be well, and I get to be a part of your healing and you get to be a part of mine. And so I believe when we take seriously our mental health and our spiritual health and our emotional health, financial health, we can do this together. And so I'm excited to lead the mental health working group, to lift up the things that you all are doing that don't typically get recognized as mental health supports, but in reality are serving the need to help people feel more grounded and centered in the work that they do and in their lives, and to know more importantly than anything that they matter. And so I hope that answers it, Alex. And if it doesn't, please let me know.
That's great, Darrell. Thank you. And I think one of the things I love in the way you're imagining the mental health working group, and we're going to have a poll to ask you all what other issues do you want to take, is not going to the usual suspects. How do we understand the supports already in community that need investment and uplifting and best practices? And I think that's just so who you are too, of like going the extra mile to figure out like, how do we actually meet someone, an organization where they are and invest? And the other thing, and I don't know if you'd be willing to talk about this, and then Scott, we're going to call you in. I think you really helped us think about, and I mean, everybody on this phone, we are at 276 now, we're like up to 300, but how do we, my guess is so many of you on this call are thinking about who can I help, right? Like you're on this call to figure out how do you support others? And then I think, Darrell, if you can give 2 sentences on, you really want us to build wellness for ourselves, whether it be the core partners, whether it be the coalition partners, all of you on the phone. So that includes every single person on this phone and who listens to this later. We want to have wellness in the work. We need to. So can you say 2 sentences on that?
Yeah, I'll do my best, Alex.
Okay.
I think at the end of the day, folks don't know, but my work is centered on love. And one of the things that I talk about in love in the context of our social justice and movement building work is that in order for it to be radical and transformative, it has to center us. And if we're giving ourselves and us stuff away, everything, and my question is to folks is the reason why you're giving care and you're considering yourself a caregiver, because the ways in which you've been socialized to sort of do everything for everybody, but not to receive for yourself. And if that's the case, the way in which I would invite you back into real radical love is then to see and ask yourself, in this moment, is my giving care subtracting from my ability to love myself, or to show up for my family, or to show up in my community? And so a part of this work in being radical is to bind it both to my wellness. It does not have to come at the expense of me doing work and communities that really are important and matter too. But if I'm just giving all of my love and attention to that particular group and not to myself, I'm actually doing a disservice to the movement by doing a disservice to myself. And so that's a part of the work that I get to do as well.
Thank you, Jarrell. Denise, you look like you want to say something. Thank you, Jarrell. Am I right?
I mean, I want to say I'm receiving. First off, I want to say that it's so beautiful to be in this space where you can grow and be held accountable, right? In a way for your own well-being, right? We are nothing if we cannot be there for ourselves. And if we denigrate that, if we shame that, if we feel guilty about that. And I think every one of us who, again, are stretching beyond ourselves, who have a vision that can become a burden, right? A vision of transformation. We all can be guilty of saying, well, I'm doing this for others, right? Our wellness exemplifies the world that we want to live in. And so if we are scraping and clawing and, crawling to the finish line, we have to consider what we're actually modeling for future leaders, right? And for the community around us. So you can't pour out of an empty cup, right? Is the way that often folks say it. So I think that's the way that we're inviting people even into our joy in this moment, right? Are you having joy in the work that you're doing every day? Because we at the HECC are trying to create a space, right, where joy is present in the midst of a world that is less than perfect. And I think that we can do that. And I just am so grateful that Jarrell is helping to observe that, right, and to monitor that and draw us in.
Thanks, Denise. I want to share one thing that, and then Scott, we're going to talk to you. And so we're going to talk to Scott, and then we're going to ask you all some more questions about what should we do collectively. So Denise, I wanted to share something that, a conversation we had. So Denise has had her own health challenges, as some other people have. I think Denise speaks openly about it. I don't know if others on the team want to. But I remember this moment where we were just kind of I was still in the midst of like radiation and getting my head around the double cancer, and you were getting your head around your back stuff, which has been hard. And then we have many other colleagues, including on this call, and probably some of you have been dealing with their own trauma, their own health. And you said something that was profound and I kept with me. And this was right after I'd been to Alabama to go see Equal Justice Institute. And you're like, do you think we're all feeling this because it's the weight of the movement? And I imagine that every single person on this line feels that weight. And then you said something really funny, because we kind of manage our health stuff like it's another line of business, which we do. I like have an amazing cancer line of business where I do research and share. You have your back one, and like everybody, I'm sure everybody does that. And like how I've just been thinking about, I think this is what you're going to help us with, Drill. How do we integrate? How do we carry the weight of the movement, carry the weight of our own, and everybody we bring to this call, and stay true to what you said? But I just want to appreciate you for that, for calling it out, which was, I think, a little bit of feedback, and for just integrating, because I think that's what we need to do. I don't know if you want to say anything else, Denise.
I mean, you know what, receiving love. And I just hope that, I really, really do hope that people experience that who are on this call, who may not know us. I often tell people, I mean, as a CHW, I often tell people, I don't have to know everything about you to love you. The place where love emanates is not because you've had to share these intimate details, or that there's some duration of time. That I can want the very best for you. And that love, right, can be present, and it is present. And so I hope that people know that coming into this space, you can live that out. That can be a reality for each of us. That's a radical kind of love. That's a different kind of love, right? It's not attached to all of this expectation and meeting these standards or being or showing up in a certain way. And that's rare in a space of work. Yeah.
Thank you, Denise. All right, Scott, we're going to introduce you to Scott, and then we're going to do a last poll. Sylvia, I see your hand up. If you don't mind holding a second, you can also drop it in the chat, please do. So this is the last partner. We have other partners too that are core partners, but this is the last one that's on the call today. Hi, Scott. So Scott has been with us from the beginning, including like we used to have these 6 a.m. calls every week, just trying to figure out what's coming down the pike. And I actually totally misread Scott at first. When I first met him, I kind of just passed him off as like this heady academic. And you could, and you know, we need those too, right? So I was like, Scott seems cool. He's super smart. And then I got to know Scott, and Scott is probably one of the most loving, thoughtful, like you can't hear him tell any story without talking about, oh, mentoring this person or wanting to put this person on. He both like has this deep practice in New York in his own backyard, but can then go spread it and talk about it and speak all the academic languages, like one of the best code switchers between academia and community. And I couldn't be more thankful for all the reasons, like personally, professionally, to have you part of this crew and leading. And Scott has 1,000, Scott and Denise, like I cannot keep up with them. Let's be really clear, like 1,000 ideas a week. And it makes, I don't know, I'm so thankful for it, as I think others are too, maybe other than Jacqueline. No, I think she is too. So Scott, please introduce yourself. I think we have only a couple minutes. Like, what are you doing? What are you thinking about mis and disinformation and child health too?
I'll be really quick, and it's beautiful what you just said. And thank you, Alex and Denise and Rishi and Darrell. I'm really I'm just proud to be part of this group. And Jackie, as you've articulated, I think there's a lot we can do with HECC. And I'm actually very interested in the questions that Alex put there in your word clouds. But I'm a professor at CUNY, which is the City University of New York School of Public Health. I lead a health communication for social change master's program. We have people from around the country. It's online. And what we say as our core value is that we want to not only improve health and social justice, but health equity in everything we do. And that's what's been really good about as we've advanced this health literacy campaign and vaccine literacy is to try to connect with the community, not only in Harlem, but we have a pandemic response institute, which we're also funded by the City of New York. We just developed a journal of health communication on No One Left Behind with resources. We'll put some of these in the chat, but I think the bottom line is that we want to be able to support and be part of this. And while we know COVID is not over, we're seeing children's vaccination at risk, particularly HPV and others, as many of us have been focusing on. And we have this unfortunate, sophisticated group on mis and disinformation that needs not only community partners, trusted messengers, welcomed messengers, and all of us to approach this with a science approach. And a science approach doesn't mean scientific data. It means scientific of love and these other pieces that we're talking about in terms of connecting. So our hope is that, we can be core partners here. I am developing advancing health quality information. So how do we get the right information to people at the right time to help them make the appropriate health decisions and appropriate to themselves in their community with family and friends? So I'm just going to, sort of say there's more to be done. I'm really proud to be part of this. We have our journal, it's available. We have campaign resources, but we want to develop this together. So what we've done in the past, I think people have put you could be proud of, but what we're doing and co-creating in the future is what will make a difference in our lives, our communities, and hopefully, everyone that we serve. So over back to you, Alex and Denise. Again, just thank you for this opportunity, and I'm really looking forward to working with all of you who are on. I know you have 5,000 people that are in your network. So for 300 on any given day in the middle of summer, we are committed and we look forward to more with all of you. So thank you.
Thank you, Scott. All right, in our last few minutes, a couple of things we'd love to do. Thank you, Scott. First, I think there's an interesting, we're going to do another poll question, and it is, what issue do you want HECC to take on? Right now, we're looking at mental health, child health, obviously still working on vaccines, community-based workforce. What else do you want to see us take on? Do you want to take it on with us? Like, we are looking for co-collaborators. We're looking for folks to be able to co-lead working groups. And we're also raising money right now too, right? Like, there's the HECC we do And we pay all of our partners, obviously, that we do with a certain amount of money, and then it gets even bigger, and we invite even more people on if we can sustain it. We're really excited about that. Happy to share more about that too. So please jump on. What is it? And then I think going back to and we don't have a poll for this, but just drop in the chat, like, are you what Darrell described? And this is not a working group. We haven't figured out how we're going to do it yet, but would you be up for this kind of co-commitment to caring for ourselves and each other? And if you are, just put a yes in the chat, like, let us know. And we'll also do a poll. You can put in the evaluation, like, who wants to be on, we don't know how to do this, right? Like, Darrell has a vision. So who wants to be with us so that we change this underlying systems in the US and globally, and we care for each other. So just say yes. If you're up for it, yes. And we
So
will
many yeses, Alex.
Yes.
So many yeses. Before I could even type it into the chat, the question.
Thank you.
Yeses. And here's my email address, right? Yeses. Yeah, lots of things. And other efforts. Folks are already, plus wanting to join the comms, the communication and disinformation efforts, and with a focus on HPV, many yeses, many hearts.
Love it. Yeah, emails are great too. We'll capture that also in registration. All right. And then lastly, I just wanted to say thank you. Denise, I wanted to give you a minute if you want to say anything. We'll do an evaluation poll. But thank you. Thank you for being here. Thank you for meeting all of us kind of behind the scenes. Thank you for being part of this move. We will send out materials. We'll stay in touch. I want to give anybody else from the panel want to have last words. Rishi, Denise.
I just want to say thank you all so much. And I believe that you all deserve to be whole and to be well. And together we can do that. And so I just want to send you all so much love and positivity as we continue to battle sort of systemic inequality and sort of work towards greater health equity in this country. So thank you.
Thank you, Darrell. Denise, do you want last word?
We've been saying for a long time, really since I met you, Alex, with Rishi back in May 2020. We thought about COVID and we thought about the pandemic, but we thought about everything that was underlying and everything that came before it. And I summarized that in this question, is this a moment or is this a movement? If we continue to lean into some of these principles, what does a morally safe organization look like? That was profound to me. Can we make a co-commitment, right, to our own care and the care of one another? This is racial and health equity in our everyday lives, in the process. And it's not just about counting more widgets. It's not just about the number of outputs and how many reports we generate, but that we are living that vision that we have for others, for our community, and for our world. So I'm just looking forward to the journey. Thank you.
Thank you. All right, we're at time. We will, thanks for meeting all of us. Thanks for joining. We'll have some more webinars on topical issues, on the next steps, and please reach out. We're so appreciative of you. So appreciative of everybody, all the panelists too. Take care, everyone.